Thank you for offering to act as an educational supervisor for medical students from Chester Medical School. This presentation will cover some specific principles and recommendations for supporting students from Chester. So this presentation will cover what an educational supervisor is and the roles of an educational supervisor in conjunction with working with Chester Medical School. I'll go over the GMC requirements for educational supervisors and the Academy of Medical Education domains relevant for educational supervision as covered by the standards numbered 4 to 7. I'll also talk specifically about supporting students from Chester Medical School. So an educational supervisor is a designated senior clinician with overall responsibility for an individual student's progress on a placement. As you know, we have 3 9-week blocks throughout the year of the second year of Chester Medical School, with a different educational supervisor assigned for each one of these blocks. We aim to pair students with a supervisor within that block specialty. For an example, a medical supervisor for a medicine block, a surgical supervisor for a surgical block, and an appropriately named specialty consultant on the specialty and community placement. Therefore, whilst acting as an educational supervisor, you will have a different student for each 9-week block. It is a GMC requirement that educational supervisors have appropriate accredited training to work as and be named as an educational supervisor. He or she is expected to see the doctor on a regular basis. We suggest a weekly basis for around an hour. This can be either individually or as a small group if the ES has a number of trainees. And this can be delegated on occasion, for example, to cover times where there may be significant clinical commitments, annual or study leave, to another ES within the specialty block. It is a general recommendation that educational supervisors have 0.25 PA per 2 medical students being supervised. So how does the GMC recognise trainers? So as you may know, the GMC approves trainers and there is a specific register of trainers in general practice. However, there is no specific register for other specialty grade of educational supervisors. However, this can be recognised on the GMC register for each accredited supervisor. If you currently do not have your educational supervision or clinical supervision recognised on the GMC register, you can inquire with the GMC about having this recognised with appropriate proof of previous training. Previous training, accredited training, can include courses such as those from the Royal College of Physicians, who run educational supervision, clinical supervision training courses, and also other accredited modules from other postgraduate courses. Further information regarding this can be found on the GMC website, including if you search for criteria for trainer recognition and the approval of trainers. This course will count towards your continuing professional development as an educator through your local appraisal process, but doesn't count as formal training to be recognised as an ES. So what are the knowledge and skills required for educational supervisor roles? Essentially, GMC outlines that the role of an educational supervisor is one that can encompass a role of coaching, mentoring and pastoral care of students. You can sometimes need to provide career support to help guide students through their undergraduate study and help them start thinking about what specialties they might be interested in when they complete their training. It's very important as an educational supervisor to outline the students have undertaken a learning agreement with the university and also a personal development plan at the start of each core clinical education block. This will be agreed in the initial meeting. It's really important that ESs act to help manage and recognise when students might find themselves in periods of difficulty during their study, to both support the student and also report any concerns and escalate concerns to appropriate individuals, including academic staff in the undergraduate team in the trust, also the personal academic tutor within the university, and the appropriate clinical year lead. It's important as an educational supervisor, as mentioned, to keep your own training up to date and have an annual appraisal with your local employer. So the Academy of Medical Education has 7 domains of supervision which it's important to be aware of as an ES and a CS. Particularly with regard to educational supervision, we're going to look at these last 4 domains in this presentation. So domain 4, enhancing learning through assessment. It's really important as an ES that you know what assessments a student has to get signed off in this clinical block placement they're currently undertaking. And we will provide you with the logbooks and handbook to support your understanding of knowing what the learning outcomes are for the students. It's important that students undertake assessments as a tool to actively improve their learning rather than just measuring performance solely with exams. And as you know from the Year 2 curriculum at Chester, these workplace-based assessments are necessary in order to be signed off for their professional engagement with the year, but they do act as a formative process, meaning it doesn't necessarily matter if a student fails a mini-KEX, for example, but it's incredibly important they demonstrate engagement with the portfolio and with undertaking the minimum number of assessments for each block. As you can see from this diagram, which can be found in the logbook and information on the clinical requirements guidance, each student is expected in their hospital placements to obtain 1 OSLA, 1 mini-KEX and 1 CBD per every 9-week rotation. Assessments can be signed off by an F2 grade doctor and above, but at least half or 2/3 of those must be signed off by an ST3 doctor for OSLAs or a consultant or specialty grade doctor. Domain 5 refers to supporting and monitoring educational progress, and Domain 6 guiding personal and professional development of students. In order to do this as an educational supervisor, it's really important you have that initial and end of placement reviews, which are mandatory for each of the core clinical education blocks in the second year. A midpoint review is recommended, but not essential, but would be strongly advised if any concerns are identified for the student during the placement. Formal teaching by undergraduate medical education teams is also essential to cover the learning outcomes being delivered during the placement. As a guide, we require at least formal teaching to be done on a fortnightly basis away from clinical areas where teaching can be protected, and this can be delivered by any number of healthcare professionals, including clinical fellows, educational supervisors or other allied healthcare professionals. The teaching needs to cover the curriculum outcomes as outlined in the Year 2 curriculum talk, and we suggest for this it is done covering those core clinical competencies for medicine, surgery, community and specialty blocks. We don't ask that formal teaching covers case-based learning whilst on placement, as this is done in the university on a weekly basis in those academic blocks. We would welcome your suggestions as to any new, novel, creative styles of formal teaching you wish to undertake, and we're here to support you with any resource that may be helpful for you to implement this formal teaching. Please don't hesitate to get in contact with us. Teaching opportunities are also facilitated by teaching ward rounds, clinics, surgical opportunities, and these are to be facilitated on a weekly basis by staff, which will be incorporated into the timetables that students receive on placement. We strongly advise that educational supervisors try and get involved in regular teaching as well. This can also form part of your weekly interaction with the student. So the initial and end of placement meetings, so similar to when you might be supervising other students and doctors in training, it's really important that you make sure students have received their induction, their placement timetable, and that you review the personal development plan the student should have written at the start of that placement. We generally recommend that an initial review occurs within the first 2 weeks, ideally, of placement, and you can discuss what the placement learning outcomes are as referenced in the handbook. At the end of placement review, we would ask you to review the reflections as a minimum of 1 per block, and also the workplace-based assessments that students will be undertaking. We also ask that you review whether any concerns have been raised, whether there's been any noted of excellent practice or commendations that need to be undertaken, and that you recognise that the student is signing off appropriate clinical skills and procedures. Domain 7 from the Academy of Medical Education refers to the standard that educational supervisors continue to develop their own professional development as an educator. It's really important that you think about how you can keep your own training up to date and using available resources from the Academy of Medical Education, other online training resources, platforms, and working in conjunction with Chester Medical School. Our aspiration in the future is to have a yearly educational conference, which we look forward to inviting you to submit abstracts, presentations about local teaching projects and advances you may have been involved in.